Live better and longer with the Fitzness Show, hosted by fitness expert, author, and TV personality Fitz Kohler. She'll tell you why diets are dumb, supplements are snake oil, and the truth about how you can earn a lean, hard, pain-free, and athletic body. Now for our favorite bossy blonde, Fitz Kohler.
Well, hi, team. I'm Fitz Kohler, your super bossy fitness pro from fitzness.com, and welcome to the Fitzness Show. Today, I am in West Hollywood, California, and I made the big trip to be on a big podcast by my guest. So I'm so excited I got to be a guest on his show, the Extend podcast, but I have so much digging in his big brain to do. My guest is Dr. Darshan Shah. He is the founder and CEO of Next Health Wellness Centers and a surgeon, and he's done it all in the medical field. But I made fitness really simple, stupid. I think we decided on his podcast that I boiled things down, made them very simple, stupid, which is my forte. But he's got a whole bunch of fancy stuff going on over here. And his podcast is called Extend. I think that's because it's extending your life, but also extending beyond the basics. And I tend to hover around the basics. Dr. Darshan, welcome to my show.
So excited and honored to be here. Thanks for having me.
Of course. As we were chatting earlier, I was thinking, I have so much to ask him. So I do boil things down and keep them simple, stupid. And
Which is great. People need that.
Well, thank you. I agree. They need like a foundation to work with.
Yep.
But gosh, you really branch out, and your Next Health centers here are incredible. Tell folks about your centers and how you created them, why you created them.
Yeah, so Next Health is what's called a longevity center. And what we really focus on is expanding people's health span and really optimizing and dialing in their health. So what a lot of people do is they hear from someone incredible like you that gives them the simple things they need to do to get started and maintain a good routine, right? And then what happens is over time, people get there. They get themselves to a place where they're maybe at a weight that they love, that they feel like their routines are pretty good. And then they start asking, like, what else is out there? What more is out there? And that's where we can really take people to that next level. Now, the things that we do at our centers, and there's a lot of it, like we have all the proven science-backed biohacking modalities that people hear about, things like hot cold therapy, hyperbaric oxygen, intravenous IV therapy. But then what we also do is we have medical practitioners at every single location that are led by doctors that help people understand what do their biomarkers mean? And biomarkers can be anything from blood tests to special devices that we use to get different type of markers like skeletal muscle mass or grip strength to, doing tests on people, things like VO2 max or testing their balance, et cetera. And so we get all the data together for people. We explain what the data means, and then we tell people how to change their data.
So what inspired you? You were at the Mayo Clinic, you're doing surgeries. How did you go from that to this?
Yes, I did surgery for 20 years. Honestly, I got burnt out, and part of my burnout was becoming unhealthy because, being a surgeon, you spend a lot of time in the operating room. It's very stressful, but it also requires a lot of focus. And after a while, I did it for 25 years. I just couldn't do it anymore. I got burnt out, and I wanted to spend some time on my own personal health. So I took some time off, and I discovered this whole field of the things that you talk about: nutrition, exercise, recovery. And then I also discovered functional medicine. I decided to do a career switch into functional medicine at that point in time. And so it all just kind of came together at the right time for me.
So when you went to functional medicine, is there more medical school that goes along with that? How did you make that transition?
Yeah, so it's not medical school, but it's like specialty training. So there's large organizations that train you in the science of like hormones and toxin removal, gut health, et cetera. And so then they do the training for you after medical school's done.
So you were saying that being a surgeon was affecting your health negatively.
Yeah.
How so?
Well, so, I think it was a combination of multiple factors. Number one was you wake up really early and you go to bed very late because there's a lot of surgery to do. And so when you're in surgery for sometimes 12 to 14 hours, but then you also have like a business around surgery. So I had owned my own office and surgical center. I was both working in the operating room and also outside the operating room of the business. So a lot of hours, a lot of stress. Surgery itself is stressful. Running a business is stressful, and just very little control. When you're not sleeping and you're stressed, you just eat whatever's in front of you.
Okay.
So, I always joke I had a seafood diet. If I saw food, I just ate it, and very little physical activity. Being in surgery all day, you're not moving, you're standing in one place. And so it's very similar to being sedentary when you're standing there all day long in one place. And so I wasn't moving my body. I tried to work out, but the workouts, I was tired, they were not effective. And so it was a combination of different factors, I think.
So you're standing. What kind of surgeries did you do?
So I did a lot of different types. So I started doing general surgery, but then I moved on to like reconstructive surgery from cancer, and then I did cosmetic surgery as well.
Okay, and which was your favorite? If you were going to pick up a knife and fix someone today, what type of surgery would it be?
Gosh, I would say it's really hard to pick a favorite, but the thing that really got me excited was my time doing like reconstructive procedures because they were very intricate in many ways. They required a lot of skill, and so they were very challenging. And so I would say, I enjoyed my time doing reconstructive surgery at the Mayo Clinic.
Wow, it's meaningful too, and I'm very fortunate that I did not have to go through a reconstructive route, but I have so many girlfriends who did, who really their surgeon made all the difference in their normalcy of life or not, right?
Absolutely. Yeah, they can make a huge difference in people's lives.
So you're standing there and we see, I mean, I've watched Grey's Anatomy. I'm going to tell you I'm an expert right there.
Uh-huh.
Are you stuck looking down into a patient the whole time? I mean, how does that affect your neck and your posture? And
Oh,
are you wearing compression sleeves on your legs? I mean, what's going on with
all
you
of that.
physically?
Yeah, really, really great question. So yes, you are constantly in a kind of a neck down position. And so neck pain becomes more the norm rather than the exception. Also, you're holding tools all the time. So I've had shoulder surgery already as well for
Wow.
torn ligaments. It's physically, very taxing on your body. A lot of repetitive movements. So repetitive movement, pain and stresses become a problem. And then, yes, from standing all day long, you can imagine you get a lot of varicosities, broken blood vessels and veins in your legs. And so, yes, we do wear compression stockings as we're standing there, but, they're only marginally beneficial. So all these injuries and damage add up to real pain, real physical consequences. Yep.
Okay, so knowing what you know now,
Mhm.
and it sounds like you are far more sophisticated with health than fitness since you left surgery, and we want our surgeons to remain surgeons. What would you have done differently, or what would you guide a busy surgeon today on how to avoid some of those issues?
Yeah, I would say, never let a day go by that you don't work out. So you got to just change your schedule and make sure you're exercising every day prior to going to the operating room. And then after you're done operating, have a really good flexibility stretching routine and even consider, 3-4 time a week massage therapy
Okay.
as well. I think that's really important. Utilize tools like foam rollers, compressive, like those, devices like Therabody
Hmm.
that you can use on your for fascial release, etc. And just decrease the number of hours you spend in the operating room. I think that's critical, not just for your body, but also for your brain.
Yeah, for sure. It's
Yeah.
funny as you're talking, I'm in my mind, I'm conjured up like a 5-minute surgeon's warm up routine for stretching and strength
Great
training your
idea.
neck and pre and post surgery to avoid some of these complications because
Yeah.
yikes, especially when you're dealing with your neck. Nobody can function with neck pain.
Yeah. I'll also say, like, in between surgeries, we have like a little break in between surgeries, usually about 30 to 45 minutes to do some air squats, do some push ups, do some stretching. 5-minute routine in between procedures could be very beneficial.
Yeah, I see that. I see that. Okay, so you're here now. How many Next Health centers do you have?
We have 25. Yeah.
That's crazy.
Yeah.
Congratulations.
Thank you. Thank you.
When was your first?
The first one was right here in West Hollywood. It was a small 1,000 square foot location in a strip mall here. And that was, I think, around 2016 is when we opened that one.
Wow, so you've exploded. That's 10 years and 25 locations, and they are nice. Folks, I've posted some content on Instagram, but this is world class. This is posh, it's shishi, And it's productive too. It doesn't just look pretty. It's got a whole bunch of functionality. Your staff is extraordinary. Everybody's so freaking nice. Like I imagine they're all themed in a similar way.
They're all very exactly the same almost. And the reason you had that feeling and that, the way you just described it was very intentional. And it was because one of the biggest problems with health is that people go to the doctor's office to get health. And the problem with the doctor's office is it doesn't feel like a health place when you go there. It actually feels like sick care or disease, right?
Right.
Like normally you're in a waiting room. Usually the furniture is really old. Usually the office is hidden away somewhere. It doesn't feel inspiring to go there. Like, in fact, a lot of people, the minute they get to the doctor's office, they cannot wait to leave, right? It's like, you just want to run out of there. And we wanted to do a place that was completely the opposite. Like, I really wanted people to come in on a weekly basis. Now, how do you get people to come in on a weekly basis to go to the doctor's office? Well, you have to give them things to do that can improve their health every week. So we have what we call the longevity circuit. There's like hot cold therapy. There's infrared light beds. There is a hyperbaric chamber. There's also intravenous therapy. And this is stuff people can do like every week if they wanted to. And then we also made it beautiful. So people call us like the Apple Store of health. And I wanted that inspiring kind of feeling as you walk in. Like, I want to be here,
Well, you nailed it. You know what? It almost broke my heart to come up here to do our podcast because I was sitting in one of the massage chairs.
Yes.
Like, oh, damn it. I have to leave and do the thing I came across the country to do right now.
I know,
But
right?
they're fantastic. They are fantastic. So I saw on one of the walls the wellness wheel of longevity.
Yeah.
So tell us about.
Yeah, so that's kind of an infographic that I came up with after, talking to hundreds of people in really like trying to explain all the different facets of health. So health is actually not easy. It's a little bit complicated. And so you have to break it down for people and make it seem as though you got this, right?
Yeah.
And so the wheel has 12 aspects to it, the 12 aspects of health divided into 4 categories. And we start people like at 12 o'clock and we take them through this journey of health over the course of their 1-year membership with Next Health. And so, we start always with the basics, the foundations, all the things that you talk about. I call that lifestyle medicine. So this is how do you create a lifestyle that is medicine, right?
Yeah.
And that includes the obvious things: nutrition and metabolic health, movement and exercise, sleep and recovery. That's the foundation. We do that first because I don't care what's the problem is. If you don't fix those things, if you don't have those right initially, you can't really make a lot of progress in any other way.
Lipstick on a pig. Yeah,
exactly. It's lipstick on a pig, right? So we start there. Then from there, we move on to functional medicine. And so functional medicine is root cause medicine. It is all the things that, Dr. Jeffrey Brand, Dr. Mark Hyman, Dr. David Perlmutter, the pioneers of functional medicine talked about 30, 40 years ago that, in my view, completely changed the conversation around what medicine should be. Medicine goes from a sick care system to a real health care system. And that involves understanding that your gut health is central to your biological health. So getting your gut health in order, understanding that hormones are also natural biological signals that maintain health. And so looking at your hormone levels and making that part of your overall health maintenance system, specifically as you age. And then also detoxifying your body. Toxins are invisible detriments to our health. And we live in one of the most toxic environments ever that humans have lived in. There's 150,000 toxins in our environment that were not there 5 decades ago.
Yikes.
Yes, exactly. Yikes. But it's not an unwinnable problem. There are very deliberate actions that you can take to detoxify 80 to 90% of your life. And once you do those things, you truly give your body the time and the space it needs to catch up and handle the toxins that are in our environment. So that's like part 2.
Okay.
Yep. And then you want me to keep going?
Yeah, I do.
All right. Part 3 is preventative health, preventative medicine. But what I call preventative medicine is very different than what typical Western medicine does. So typical Western medicine, preventative medicine is mammograms, colonoscopies, And then, PSA levels if you're a man, and OBGYN checks once a year if you're a woman.
It's so interesting as you're
Uh,
saying this. It's not really preventative at
No.
all. It's the actions are preventative. Those are
Right.
screenings to see if you've already screwed it up.
Exactly.
Right? Okay.
Exactly.
All right, let's go.
So I changed the word to hyper preventative medicine. This is looking at your heart health, cardiovascular health, looking at your brain health, and looking at your immune system, which protects you from cancer, and optimizing those three aspects of your biology so you don't get chronic diseases.
How do you do that?
So we can talk about each one of these individually,
Sure.
but like cardiovascular health, for example, everyone knows about managing the cholesterol, right? But it's not just about your cholesterol. It's also about keeping inflammation low, fixing your metabolic health, and then proactively checking to make sure you don't have blockages in your arteries, and also keeping your blood pressure normal. Okay. And not just I would say managed, in medicine, we do a lot of managing.
Right.
It's not normalizing. We want to normalize, okay? And so that's for cardiovascular health. Brain health, same kind of things. We sometimes wait until we get Alzheimer's disease or cognitive impairment before we start thinking about our brain. But true brain health can be maintained by using some of those same factors, but also making sure that you're not injuring your head
Right.
and all. There's a whole paradigm that we have around brain health. And for immune health, and which protects you from cancer, but also infections, there's quite a few things you can do there to also maintain an optimal immune system. So just being hyper preventative and testing frequently and sooner to diagnose disease way before it becomes a problem. People get diabetes and then we start giving them medication. The reality is, for 30 years prior to getting diabetes and needing medications, your metabolic health was a problem. So how do we know
Right.
early? That's the critical question there.
Yeah. Isn't it so frustrating how many people have sacrificed quality of life because they're just terrible habits?
Mm-hmm.
Whether they were raised with them or they chose them, but God, a type 2 diabetes. The University of Florida had the Diabetes Institute, and I was on their board
Yep.
when it started. And there was a man who was also on the board. I can't remember his name, but we had a chat at lunch one day, and he said, I used to be a big fundraiser, and I worked to help find a solution for AIDS.
Mm.
He's a gay male. He lost some of his boyfriends. And so anyways, there was a real passion. He goes, AIDS is fine now. AIDS, we got AIDS. He's like, diabetes, so much more difficult to have than AIDS. You have to manage every bite you take, every move you make. So much more difficult. I was like, it's just so preventable too.
It is.
Type
Yeah.
1's a heartbreaker, but type 2,
Yeah.
you don't have to have that. You really have to act out for a long time to earn type 2 diabetes. Am I wrong?
You're not wrong at all. In fact, type 2 diabetes is the end result of poor metabolic health. And the sad fact is 90% of Americans have poor metabolic health right now. The thing is that you can live with poor metabolic health for decades before it turns into diabetes. And you don't even know it. And that's because people don't know what are the markers of poor metabolic health. And so it's so important for people to understand what are the blood tests that tell us that we have diabetes, right?
Yeah.
And so once you know what that blood test is, then you can start managing them way ahead of time, decades ahead of time. So you don't even get to that place in the first place. I always say, like, if the Titanic had gone 1 degree a different direction from the very beginning, it would have never hit the iceberg. But not only that, it would have ended up in a completely different continent,
Right.
So
Yeah, 1 degree can make all the difference, right?
Exactly.
Golly. And with something like diabetes, wouldn't it be nice if people were in a position that it would be outlandish for them to have type 2 diabetes? Like, for example, if you or I were diagnosed, we would be stunned
Yeah.
with that. Don't be a person who likely gets diagnosed with type 2 diabetes, and figuring that out isn't very complicated, right?
Right, exactly. And so, I think for your audience, they should know what are the markers of diabetes.
What
And
are
so
they?
The one that doctors use to diagnose diabetes is a blood test called hemoglobin A1C. Hemoglobin A1C is a 3-month average of your blood sugar. Okay. So when this number gets to 7.0, it means you have full-blown diabetes.
Okay.
But when you get to 5.7, it means that you're pre-diabetic. And 6.5 is when they diagnose diabetes and they put you on medications. Okay. Now, for it to go from 5.7 to 7 or even 6.5, sometimes it takes like a decade, right?
Wow. Okay.
A decade before it goes to 5.7, it's 5.2 or 5.3 or 5.4. So you want to know when it's not optimal. An optimal hemoglobin A1C, in my view, 5.2 or less.
Okay.
So we test our blood, this marker, on every single one of our patients at our clinic. And look, if they're 5.2, we're like, you got it. You don't, whatever you're doing it right. That's great. If it's 5.4 or 5.5, we tell them like, hey, we need to start like doing something different, because if we don't, you're going to head towards 5.6, 5.7 and worse, right?
Yeah.
And so we can make a change now. So every person listening to this podcast should ask their doctor, get a hemoglobin A1C. And if it's over 5.2, we need to start working towards getting it to 5.2 or less.
Okay.
And that's how we do it.
I'm going to interrupt super quickly.
Yeah.
Just because I know you had also asked her about your makeup.
Oh,
Something
man.
with your eyeliner, and we've got a big
The smudge right there.
black. Yeah.
Damn
I
it.
mean, just
Oh, it's gone.
I figured you would
I
want to
fix
know.
it.
Yeah. Close your eye again. Way better. Thank you.
Oh my
Okay,
gosh.
good.
That was so nice of you. Thank you. I'm not very good at makeup.
I didn't even notice it.
Thank you. Thank you. Yeah, my audience would be like, of course she's got makeup smeared on her eye. Duh.
That's
Okay.
hilarious. So yeah, so you want me? So let me just pick up. So yes, hemoglobin A1C is a blood test that every person needs to know what their level is, and this is a readily available blood test. You just got to ask your doctor for it. And guess what? If your doctor won't get it, you can go to any lab now, Quest or LabCorp, and ask for it, and they will get this for you. And there's there's businesses like ours that you can come to at Next Health, and we measure this as part of our baseline blood panel, and we tell you what it is, and we tell you what optimal is and how to get there.
That's brilliant. That's brilliant.
Yeah.
So one of the things that I find interesting is some doctors who are a little nervous to tell their patients what's really going on.
Mhm.
I have folks that are morbidly obese. They'll go to the doctor. I'll say, please go talk to your doctor about this. I'm concerned. I look at someone in the obese category as walking around with a gun to their head. You just never know, right?
Yeah.
But some of them will go into the doctor and the doctor will say, well, your blood looks fine.
Yeah.
I'm like,
It's a big problem. And the reason it's the big problem is because a lot of times the standard blood panels that doctors do don't even test for the markers of health. They're testing for the markers of disease.
yeah.
So, most lab work done at a primary doctor's office is what's called a CBC, which is a blood count. That doesn't change unless you're like bleeding to death or you have a severe infection, or what's called a complete metabolic panel, which also tells you if you're like knocking on death's door for like electrolyte abnormalities or your liver or kidneys are failing. Those are not the blood markers of health.
Right.
The blood markers of health are like the hemoglobin A1C. There's also another one called HSCRP, which is a measure of, sorry. There's also another one called HSCRP, which is a measure of inflammation. And we all know, the longer you live with inflammation, the higher risk of cancer, heart disease, or diabetes. And then there's other ones like, for example, your vitamin levels, vitamin D level, vitamin B12 levels. And then there's ApoB, which is a measure of heart attack risk. So these are the ones that I like to measure. And for your audience, I have an online guide. It's free. It's at drshah.com/biomarkers.
Okay.
And if you put your email in, I'll send you a list of these blood tests and what they mean, why they're important, how to ask your doctor for them, and also what is optimal range and how to get there. So there's not a lot of them. There's like maybe 10 or 12, but we live in an era now where every person should be empowered by the knowledge of what's going on in their own body. We've had this in medicine for decades, but we've never shared those numbers with patients and people. Now is a time where people have access to their data. They should request it. They should have their data. They should know what it means, and they should know how to act upon it.
Well, it's such good advice, and it's interesting to me how many people they self-medicate. They're like, well, my friend is taking B12, and I'm going to take that, or my friend is doing this, or they go into I'm just quoting again, the quote unquote a nutrition store, and they get this non-expert minimum wage person giving out guidance to whoever walks through the door on what they should buy. I think there's some real there's some real validity and a value in some of the supplements out there, but you have to know what you're taking and why, and have a conversation with your doctor or a registered dietitian. Am I wrong on that?
Not at all. I mean, I think, sadly, sometimes a lot of people are, like you said, self-medicating with supplements. Supplements are like one of the last things you should do to obtain health, right? So if
Right.
you're at the supplement store, you better be working out 3 days a week. You better have your diet on point.
Right.
Sleep is good. All that needs to be done first. Otherwise, you're just throwing money into the wind. And then you're also throwing money into the wind if you're buying poor quality supplements as well. And then lastly, getting advice from someone who, you know, minimum wage
The
that
wrong
works at a
person.
store is the wrong person, right?
Yeah.
So how do you think about supplements? Here's what I do. I think that there's, like I said, it's, usually towards the end of like a program that we've created that provides optimal health from a lifestyle factors first, right? And then I ask people like, how many supplements do you want to take? Some people's like 0. I don't want any supplements. And I respect those wishes, but I also make sure that they are getting their nutritional foundations from their diet, right?
Right.
That's critical. If you're not going to get enough of your nutritional foundation from your diet, you're going to be nutrient depleted, and that's a problem. The second thing I say, most people will take some foundational supplements. And so what are the foundational supplements, I think, for people? Most people are deficient in vitamin D, so vitamin D3K2, an omega supplement, because most people don't get enough omega fatty acids. And then also creatine, I think, is also
Okay.
very valuable for people. And then from there, we can build upon that with more if people are willing to try a few more things. But I don't like taking more than 5 or 6 supplements myself, like me personally. And they're always extremely high quality and chosen very mindfully. So,
So since the supplement industry is unregulated
Yeah.
and they can basically say anything
Yep.
they want without consequence, how do people find high quality supplements?
yeah. So what I use, and I'm an advisor for this company, it's an app. It's free. It's called Suppco, Suppco. You can download it on the App Store, and it's like a consumer reports for supplements. It grades supplements on quality, efficacy, science, all of that. And so they've done all the hard work for you. And it's a fantastic resource for picking high quality supplements. And I actually have my own protocol on there. So you can upload your protocol, and mine is on there. People can search for it and they can see what my protocol is.
Well, that's huge. I do a lot of Q&A on the Fitzness show, so people send in questions and I get a lot of supplement questions.
I
And
bet.
honestly, they break my brain because I'm like, I don't know who I trust. I don't know
Yeah.
who I trust, but I
Yeah.
trust who you trust.
Yes.
That's easy
yes.
for me now.
I've done deep research on this topic because, I put supplements into my own body. And so I'm not going to put something in my own body with my level of knowledge and not know what's the right ones,
Right,
And
of
so
course.
it's embarrassing for me if I'm taking a garbage supplement, right? And so,
Yeah.
I was very happy when I researched all my supplements and I'm taking a Suppco that they were high quality, marked at the highest level. So there's definitely it's much easier now. Finally, this is as of a year ago. Prior to this, it was a wild west for me too. I was like, what do I choose? And I had to do a lot of deep research, but Suppco has made it easier.
Okay. That's a great resource.
Yeah.
I mean, you know what? I love it when my show has the golden nuggets.
Yes,
That's a golden nugget.
it's a golden nugget.
Ding,
Yeah.
ding, ding.
That and my biomarker guide, that's going to be
Okay.
a big help for people that are like trying to just sort through their blood tests and what they should order and what they should ask their doctor for. It's a game changer for people once you have
It's
that
so great. There's
information.
going to be some doctors all over the place like, what are they asking me this for? How do they know?
Yeah.
How do they know?
Yeah,
Armed with information, right? Armed
Exactly.
with knowledge. So, did we finish the wellness wheel?
no.
Okay.
The last part of the wellness wheel is longevity technology. And so these are the things that people hear about in the biohacking world, like LED light beds and,
Okay.
peptides and supplements and these kind of things. And so I made it last on purpose because it has to be the last thing you do is the tip of the pyramid.
Okay.
But like once people start listening to your advice and they start doing all the right things, they get healthy, they feel great, they want to know what's next because
Yeah.
feeling great is addictive, right?
Yeah.
You want to do more, because now you're in a good routine and you're like, I'm sure there's more I can do. And so in the longevity sphere, there's many things that you can explore, like peptides, for example, that can move the needle even a little bit further.
Explain peptides.
Peptides are natural biological signals that our body makes to signal specific actions that keep us healthy. Unfortunately, many of these signals are broken because of various issues, poor gut health, inflammation, And then also, as we age, some of these biological signals also start to decline. Hormones are an example of something that declines naturally as we age, just because our bodies are now living a lot longer than evolution thought we were going to live, right? And
Right.
so hormones are some of these signals. There's other signals that come from our gut. A very famous one right now is GLP-1, like Ozempic and, tirzepatide. This is a peptide, actually. And these are natural biological signals made in our gut to signal our brain that we're full. And they also, like many biological signals, have actions that go way beyond just that primary action. So there's GLP receptors on your immune cells. There's GLP receptors in other gut cells. There's GLP receptors all over your body. And so there's lots of various effects that these peptides can have. And so the GLPs are one kind of peptide. There's other ones, like there's peptides that help with healing, like BPC 157. There's peptides that boost your immune system, like
Really?
TB 500.
Okay.
Yes, and there's peptides that actually boost energy production in your mitochondria, like MOTS-C. And so there's about, there's probably 1,000 different known peptides, but probably about 5 or 10 that we use clinically.
And we will be right back. My brand new book, You Supercharge, the exact formula for fitness, weight loss, and longevity, is out right now and has something for everybody. Ladies, chapter Full Throttle Femininity is dedicated to all the things you think you can't control, including menopause, weight loss, maintaining muscle mass, building bone density, and earning yourself a JJ of steel. Guys, chapter Man Mode was written just for you. You'll learn how to combat menopause, tune up your ticker, banish a beer belly for good, maximize your muscles, and earn the most powerful pecker on the planet. From the ground on up, from the inside and out, let's supercharge your body and mind and make you unstoppable. Order signed copies of You Supercharged at fitzness.com in the United States, Amazon, everywhere else. We're back. So what do you think about the direction the GLP-1 peptides are going?
Yeah. So unfortunately, they're simultaneously going in two directions. And let me explain what I mean by that. There's responsible professional use of GLP-1 peptides, and there's irresponsible terrible use of GLP-1 peptides. So the irresponsible way of doing GLPs is either you ask your primary care doctor for it and he just gives you a prescription, or you buy it online from, either an online distributor that makes you fill out a form and you get it in the mail, or you just go to like some website that sends you research grade
Lord knows who.
peptides. Lord knows who, right? Exactly. And so that's irresponsible, number one, because it could be dangerous for you. Number two, no one is managing the dosage. And what I find in people doing it that way, where you don't have a professional really managing this for you and having the conversation about how to do these right, you end up then losing muscle mass. You end up with what's called gastroparesis, where you start throwing up constantly, constipation. You end up actually also getting dehydrated. Lots of problems develop. And so, you probably heard like people that use GLP-1s are getting losing muscle, right?
You know what? I heard of someone, there's a lawsuit in England of a guy who lost like fat in his ear. He has permanent ringing in his ear from overdosing on.
Yeah. And so those things can happen when you overdose, you don't have someone managing the dose, and you have people just using it just like willy-nilly, right? And so, with any natural biological signal, you have to like really keep a close eye on what's going on with the dosage that you're giving and also the effects. And so the responsible use of peptides, you can see incredible effects. And the way we do it at our facility is if someone is trying to lose weight or they're trying to get their metabolic health in order, we start them on a peptide dose, and we don't just increase the dose all the way to the max dose. We actually stop increasing the dose when they're losing about 1 pound a week. That's when we stop.
Okay.
We also make sure they're gaining muscle as they're losing fat. So we're adding protein, we're adding strength training, we're monitoring their muscle mass with a special scale called the bioimpedance scale. We're also increasing like creatine. And so we're very intentional about watching their muscle mass and strength increase as they're on the GLP-1s. And that's critical. The other thing we're doing while they're on GLP-1s is we're forming their relationship with food. We're teaching them how to eat healthy. We're teaching them how to avoid ultra processed, avoid large doses of carbs before they eat their protein and their fiber. We're teaching them how to use a continuous glucose monitor if their metabolic health is in disarray, like if their hemoglobin A1C that we talked about earlier was too high. So
Yeah.
we do all these things simultaneously. So when they're on GLP-1s, that time period that they're on it is extremely positive because they've gained muscle mass, they've decreased fat mass, they've fixed their metabolic health, they have a new relationship with food that's not addictive, that is not filled with a bunch of food noise in their head all the time. And we've seen massively powerful changes, but it takes a lot of work to get there, both in the patient and the doctor.
Well, and it should. It's fascinating. My
Yeah.
whole career, I've said there is no magic pill.
Hmm.
There is, and I actually would point. I would say, unless the wealthiest overweight person on earth is now thin for good, there is no magic pill. That was Oprah. So Oprah finally got the pill, right? Or the shot, and she's doing great. But it's also like alone, they're not the answer. You
No,
cannot be fit.
it's not a
You
magic
cannot be
pill,
healthy.
right?
You can definitely lose weight,
Hmm.
but then not without consequence. So it has to be both hand in hand, the exercise part, the nutrition part.
Yeah.
And I think it's great that there's something to support folks that are in dire places lose a
Yep.
lot of weight. I think that's very exciting. I wish folks would just choose to do it the old-fashioned way with
Hmm.
discipline and intellect and so forth. But okay, fine. I think obesity is scary enough that it
Yeah.
deserves aggressive measures.
Yeah. Yeah, exactly. And like I do think there's a certain cohort of people that have you look at it as a shortcut, right?
Right.
But I also think a large majority of people have tried the old fashioned way. Like they've tried everything and they've become frustrated and they've given up.
Yeah.
And I think also for the first time, we have a drug that is actually just a natural biological signal that can give people a little bit of an edge so that they can put those actions and habits into place. And so I think, for the first time, and the research has shown this, actually, the latest statistics have shown, we've actually like gone down in our obesity rate for the first year ever
Yeah.
versus going up. And this is going to change, if this continues, hopefully it will continue, this is going to change the amount of money that we spend in healthcare.
Oh my gosh.
I
Yeah.
mean, we can't, it's non-sustainable right now,
That's
right?
right.
It's going to change a lot of how people live their life as far as their health span is concerned, because obesity leads to Alzheimer's disease. Obesity leads to heart attacks. At least obesity leads to cardiovascular disease, which is also strokes. And so obesity is at the core of why people are living the last 20 or 30 years in a state of poor health and disability. And it's a massive burden on the system, but
That's
it's
right.
also a massive, it's a depressing way to live, right?
Yeah.
And so no one wants that. And so, I'm very hopeful that, this could be like step one in a true change,
Yeah. No,
Yeah.
I am hopeful for it too. When all this stuff started panning out a couple years ago, I was asking my doctor friends, what do you think about this? And last one of them said they're good. I feel
Mm,
happy about prescribing them. So,
yeah.
I
As long as
stay
they're
in my
doing it
lane.
responsibly.
That's
As
right.
long as they're doing it responsibly. I think for anyone in kind of in your field, you're going to start seeing a lot of people now coming to you that are on GLP-1s. And the critical question asked is like, okay, you're on this, but tell me what are you doing while you're on it? Are you reforming your relationship with food? Are you fixing your metabolic health? And are you building muscle? If you don't have those three things going on simultaneously, you're not doing it right.
You're right. You're
Yeah.
right. I love that. Well, I'm going to make them all listen to this show.
Yeah, there you go. Send them this episode.
So do we finish the wellness wheel?
Yes. So that's the end of the wellness wheel. And so that's kind of the journey our patients take through their health and wellness journey to fully optimize their health.
Okay, so I have a question because you mentioned hormones.
Yeah.
Recently, administration came out and said, we were wrong. Shame on us, but estrogen is a really good thing for women, and you don't have to worry about it causing breast cancer and so forth. So tell us your thoughts about that.
Yeah, I just want to say I told you so. When I was in medical school, we were taught you will get sued and you will lose your license if you prescribe estrogen to women. And the reason is you're likely causing them to have breast cancer and heart attacks. And so many smart doctors back then said, show me where it says that.
Right.
And they pointed to a study called Women's Health Initiative. And Women's Health Initiative used synthetic estrogen on older women, okay, 60 plus, that were already in poor health and gave them the synthetic estrogen. And then they had more heart attacks and breast cancer, okay? Now, the reality is that most doctors that were using hormone replacement therapy back at that time, many of them were not using synthetic. They're using bioidentical. And they were using it for people in perimenopause. They're not waiting till they were 65, whatever, to give them estrogen. And so they're like, wait a minute, this doesn't make sense. Like, our women are thriving. They're looking great. They have less heart disease. They're clear mentally, etc. Like, none of this makes sense. However, the dogma became estrogen therapy is harmful for women, so don't prescribe it. So now we have, 2 or 3 generations of doctors that were taught that. And, once you have this entire cohort thinking in one way of physicians, it's really hard to change. And so finally we see, number one, that the study misinterpretations were canceled out by numerous studies showing estrogen replacement therapy is definitely a net positive for women. It protects their brain from cognitive impairment. It protects, more women get cognitive impairment than men do, and that's because of low estrogen. It protects their bones and their muscle from osteoporosis and muscle loss, and it protects them from cardiovascular disease. So why would you not want to take estrogen?
So,
You
so I had the estrogen eating kind of breast cancer. I was estrogen positive.
Right.
So, I was a little scared. Now, mind you, I feel 23. I have zero setbacks from whatever. Well, that's a lie. I'm dinged up. But I don't feel like, I need to get estrogen.
Yeah.
But for a grown-up fit woman, is estrogen something all of us should be talking to our doctors about?
I would say you should talk to your doctor about it. Now, look, your case is very different because you did have an estrogen-eating breast cancer, right? And so just like testosterone replacement therapy for someone that has a prostate cancer, those are the people that should not get it because it will feed that one tumor.
I should still maybe not have estrogen. Is that what you're saying?
Look, I would say you need to talk to a very skilled hormone replacement doctor,
okay,
an endocrinologist that you can talk to about this. Your friend Dawn is a really good person to talk to about this.
Yes, she sure is, yeah.
And so, there's a risk versus benefit conversation to have there for sure, okay? There are some doctors that will, in some select cases of women that have had breast cancer, still prescribe it, but you definitely want to go down the rabbit hole about, talking to the right physicians that are true experts in this, in the very specific case of breast cancer, and specifically estrogen receptor positive breast cancer. You want to be extremely careful in those cases. Yeah.
Okay. So I still am in a special category. And so many of my listeners are my breast cancer besties. We all kind of stick together.
Yes.
So I'm going to switch gears because the other thing you do in Next Health is some vanity procedures, Botox and filler and microneedling and all sorts of things. I'm a big fan of microneedling, chemical peels. I've felt like they really have helped my skin. What would you suggest is a great, bang for your buck, effective treatment that anyone could use?
Yeah, I really like microneedling as well.
Okay.
It stimulates collagen repair. Specifically, when you tie it with good skincare, it can have a big difference for your skin. I also think like Botox and fillers are great therapies for the right person and having it being done by an individual that really knows what they're doing. Right? I think they get a bad rap because some people just go crazy on natural, especially here in West Hollywood.
I was just going to say, you're in Los Angeles. What kind of, do you see a lot of crazy requests?
Yeah, I think people get, unrealistic about what they can achieve. They also get a lot of attention with an unrealistic look. And so they go too far in the direction of looking plastic, right? And so that can become a problem. That's not the norm with these therapies. The norm with these therapies is, I know most of the practitioners, they want to stay realistic. Unfortunately, a lot of times they get pushed into doing unrealistic things and then they unfortunately do them too. It's on the practitioner too to not go there. But, it happens. And so I think you just got to be careful.
So I've been told by I have some friends who are plastic surgeons, because why do they look so cartoonish? Why are doctors doing this? And they said some of their patients want the look. It's a status symbol. I have wealth. I have the means. I mean, do you believe that's a legitimate claim? Is like some of these people really they want to look like they've had work done?
Yeah, I have my personal feelings about it. Like, I would not do that for somebody.
Okay, so
Me
do you tell people
personally,
no?
absolutely all the time. Yeah, I'm just like, I'm not the guy to do that for you. I just don't do that, you know?
Okay,
And so, but there are people that is kind of what they're looking for. And find a doctor that will do that. And so then there's doctors that have reputations that will take you there, you know? And a lot of them are right here, like a few miles away from here. And so, yeah, it can, to each his own, I think,
right.
obviously you have to have the risk versus benefit conversation around this stuff because there are risks to going unnatural. It can cause further damage that is unrecoverable in the future as well. So,
So you were saying Botox fillers.
mhm.
What about lasers?
Yeah, there's great laser therapies out there. Lasers, there's different laser wavelengths. And so there's red light that can eliminate like rosacea from the skin or broken blood vessels. We also have like YAG that can take away.
What is YAG?
YAG laser can help take away. There's different types of YAG lasers. And so some of them can be used for tattoos, some also for like skin blemishes, kind of a
Okay.
thing. Then there's resurfacing lasers, like CO2 resurfacing lasers that can have a similar effect to like a deep chemical peel as well.
Okay. I've heard, so I follow some dermatologists on Instagram and they said the CO2 laser was a 10. That's a highly effective.
Highly effective, but also like, there's a long recovery period. So
Was that right?
yeah, in general, the more effective, the
Okay.
longer the recovery. Yes. Like you have to be hidden away for a few days before you come out and can't expose your face to the sun, those kind of things.
Okay. Okay. I remember, what was it? Extreme Makeover. Do you remember that TV show where they would take this person and a month later they would have a big reveal and look how they look? But it looked like they'd ripped all their skin off in
Mhm.
surgery.
Yeah.
Peels are different now.
Yeah, yeah. I mean, I think those peels still exist. Those really deep, they're called phenol peels. They still exist. Some doctors still do use them, and they create like a flash burn to the face, right? Like a deep
Yikes.
burn, and then the collagen regenerates, and it all comes back brand new, and then the deeper lines and wrinkles go away, and everyone's happy, But also, the depth of the peel, the more the depth of the peel, the higher the risk of potential problems like infections or
Okay.
scarring and also a longer recovery period.
Okay. What percentage of your vanity procedures are bought by men?
Probably about 20%, I would say.
Do you wish more men would invest in their skincare?
I don't wish more men invest in skincare. I just wish more men knew this is something you could do about it. I think also for men in particular, hair loss is a big issue, right?
Yeah.
And so, excuse me, I think more men need to explore, if their hair loss for them is an issue and they don't like the way it looks, they should explore getting it taken care of because now we do have very successful therapies that we can do for hair, such as exosome therapy.
What is that?
Exosome are injections that you can do with the hair follicles that can help them regenerate
Is
and
that right?
regrow. Yes, yeah, works for men and for women. There's also peptides now that we can use.
Really?
Yeah, supplements that we can use that can help hair growth. And then finally, hair replacement therapy is really state of the art now. You can get a really good hair transplant procedure done fairly inexpensively, actually, with low risk and high benefit.
Is that right?
Yeah.
Well, good for guys. I tell you what, I think bald is super hot. When I did cancer, I considered buying wigs, and I was like, you know what? Men don't hide their bald head. Men look great bald. I don't think I ever looked great bald, but it's such a great look. But I could also feel the pain of loss. It's no fun if you're bald because you had no choice.
Yeah.
And so, for all the men who would like to have some hair, there are legitimate options to give them their hair back?
100%. And I think, bald does look good on a
Yeah.
lot of men. And it's really that in between stages with that male pattern baldness where, you go through different levels, stage 1, stage 2, 3, and you lose kind of like, the whole front of your scalp, right? So you're not bald, but the front is gone. Then you have a big patch in the back of your head with no hair. Those are the stages where hair replacement should be considered. Once you've lost kind of all of it or near all of it, it's hard to recover. And then just, shaving the rest off is probably a good idea.
Okay. And
Yeah.
is it true that you can have minoxidil orally and that will help your hair grow?
Yeah, I mean, there's definitely like Propecia, minoxidil that are medical therapies you can take.
And they're effective.
Mhm. Absolutely.
That's great.
Yeah.
Yeah, like the magic of medicine.
The magic of modern medicine. And, we're probably only a few years away from having stem cell therapies that can help the hair as well.
That's pretty cool. Pretty cool.
Yeah.
Okay, so I had a cardiologist on my show a couple years ago, and he had a segment online called Save the Schlongs.
Hmm.
And it was about erectile dysfunction being often being an indicator of heart disease because
Yeah.
the penile artery is clogged. And I thought that was a real like, wow, I did not know that. I don't know how many men were thinking, my wing's not working, it must be my heart. So what are some other surprise connections that you wish people would make?
Yeah, I mean, cardiovascular disease manifests itself in many different ways. And so remember, every organ of your body, whether it be your penis or your vagina or your liver or your brain, has a blood vessel. And your body relies on this blood vessel to supply to these blood vessels to supply it with the much needed blood to produce energy, right? And so what I would say is, there are many signs of heart disease, particularly in women, that they don't recognize. And for women especially, they're not going to get the typical chest pain when they're about to have a heart attack. A lot of times it can manifest itself as sweating, or a lot of times it manifests itself as an inability to breathe. And they
Yeah.
go to the emergency room and they get diagnosed with anxiety and sent home with an anti-anxiety pill when really they're having a heart attack. And so that's something that, I think a lot of women need to recognize. Like if you're feeling out of nowhere that you're having like an anxiety attack, or you just don't feel right, or you can't breathe, or you have back pain, it could be a sign of a heart attack. And so insist on getting like an EKG and getting checked for that.
Wow. And heart disease is number one killer of men and women, correct?
And women. Exactly.
Yeah, people
Yeah.
forget it's women too. Isn't that interesting? We just think of, I can't pull up the name of a woman I cared about that I lost to a heart attack, but I can name some men, but it's also women.
Yeah.
That's
It's
wild,
also
right?
women. Right. Absolutely. Yeah.
Are you looking for the perfect gift for a loved one battling cancer? The Cancer Comeback Series by Fitz Kohler offers hope, inspiration, and practical guidance. With Your Healthy Cancer Comeback, My Noisy Cancer Comeback, and the Healthy Cancer Comeback Journal. These books are a lifeline for all patients and survivors. Right now, you can order autographed copies at a special discount. Show your support and help a loved one go from sick to strong. Visit fitzness.com today. That's FITZNESS.com. Fitzness.com.
Okay, so we talked about fitness. We talked about the 4 pillars, and my audience knows strength, cardio, flexibility, balance. I think
Yes.
strength is by far the number one pillar that
Mhm.
people should focus on. What do you think?
Yeah, I agree. I mean, I think it's hard to differentiate a lot between sleep and strength, because if you're not sleeping well, it's really hard to go to the gym and build muscle, right?
Yeah.
And so I think sleep, if you're not sleeping well at all and you have no energy in your day, you got to focus on that first. You got to figure out what your sleep problem is, right? A lot of women and men both have sleep apnea and they don't know it,
Yeah.
and so getting that diagnosed and treated can be a life changer. And then once you do that, then you can go to the gym and start exercising and building muscle and cardiovascular fitness, what have you. But yeah, it's somewhere in there, it really is somewhere in there between sleep and muscle. And obviously, like, you can't discount the power of a good nutritious diet too.
That's
So,
right. That's right.
right.
That's right. This, or that. Okay, what do you do for mental health? What makes you happy and relaxed?
So my mental health kind of key for me is having my morning routine where I have 45 minutes of myself, do my own thing, exercise, do a little bit of reading and some journaling. And that at least I get that win in during the day. Like I feel like I won the day once I get those
Yeah.
things in. Secondly, I love, at 2:30, 3 p.m., if I can get a 20-minute nap in and just totally do a meditation, which sometimes leads to a nap, that's so beneficial for me for the rest of the day. Like I just feel like I'm recharged for the rest of the day. And then, I'm a big believer in making sure you have time for self-care. So like a weekly massage or a walk, every Sunday morning, just going out in nature and taking a walk. Sometimes even just by myself without
Yeah.
my phone, without headphones in.
Without your phone?
Yeah. I'll leave the phone in the car.
What?
Yeah, I know, right? Imagine that.
And then what's your favorite service at Next Health to experience personally?
It's so hard to pick a favorite, but I really like doing hot and cold. Like I love sitting in the sauna for like 30 minutes and doing cryotherapy. So that's, I think, one of my favorite things to do if I don't have a lot of time, like in a pinch, because all that takes 30 minutes. But then also, like, I really love getting in the hyperbaric chamber for 45 minutes and just disconnecting.
That was nice.
Yeah, that's like, you did that today?
I did.
It's so
I
nice,
did.
right?
I did. I wish I would have put my phone down. I was trying to get up our video from the chamber, but
Yeah.
I should have relaxed. Now, how long can you sit or be in the cryotherapy?
I do
room?
3.5 minutes.
Okay.
Yeah, 3 minutes, 30 seconds.
Okay, I want you to guess how long I did it for.
3 minutes, 30 seconds.
2 minutes.
Ah.
I bailed. I couldn't do it. I tried
Uh-huh.
so hard. I was jumping up and down, trying to run it out. It was the coldest I've ever been in my entire life.
Yeah.
I did feel the exhilaration. I thought, okay, I get why people would like this, but I just couldn't do it. I just couldn't stick it out.
So you have to listen to my episode with Kristen Weitzel on my podcast, and she's a cryotherapy coach.
Okay.
So she does a lot of things, but really coaches women through cryotherapy, because I think that both men and women, the way you go into cryo has profound health benefits. And what I mean by that is it's a really great time to take control of the balance between your sympathetic and parasympathetic nervous system, right?
Okay.
And that's really like when you go into cryo and you're stressed out and you can't wait to get out of there, you're letting your sympathetic nervous system go into overdrive. But what Kristen says is if you use that kind of impetus go into overdrive, but then control it and take it down, do a breath work practice before you go in, really take control of your emotional reaction around it. And when you're in there, you're going to have that kind of drive to like freak out and get out of there.
Yep.
But you now have this very intentional, almost like meditative parasympathetic tone that you get into. It's training your nervous system, right? And if you do that, you could have profound benefits for your HRV, the control of your sympathetic nervous system, your cortisol, all of it.
Well, I had none of that. I had only, holy cow. I remember looking at the clock thinking I was in there for almost 3.5 minutes, and it was like 1 minute and 15 seconds. I was like, oh my gosh, I don't know if I can do this.
Yeah.
I had all these conversations with myself. So what song do you listen to? Folks, they give you earbuds or a headset along with gloves and socks and stuff. But yeah, I was told by Danny, who I love. Danny's
She's the best.
the best. She said, pick a song. I chose Ludacris, Get Back. I thought that would carry me through. Luda did not carry me through. What song do you prefer for cryotherapy?
Ice, Ice Baby.
Is that right?
That's one of them. I vary it, but that's a funny one. Though, when they ask me, I go to all my neck cells and I get into cry. I'm like, what song do you want? I'm like, Ice, Ice Baby. And they're like, wow, that's so funny. So that's what I end up listening to a lot of times.
So funny. Okay. For the folks at home who are nowhere near your facilities and they want one extra thing they can do at home that's kind of spa-like, some place for them to improve their mental health or their physical health, what's kind of a makeshift version of one of your favorite therapies here that someone could do in their home?
I mean, one of the most effective things that we know from decades of research is doing some sort of sauna. And so if you could find one at a local gym, at a sauna place around your house, a lot of places are putting saunas in all over the country now because, there's so much science behind it. It's great not just for detoxification and also for, like the heat has powerful anti-inflammatory effects, metabolic health effects. It's also really great for your mental health because you can't bring your phone into a sauna. It will die in the heat after
Oh,
a
yeah.
while.
Okay.
And so you're there and you have to sit there and you have to control like your reaction, a little bit of that parasympathetic, sympathetic tone. And then it just feels very meditative. So I think that's very helpful. And if you can't find one, there are a lot of places that sell like infrared sauna blankets or like makeshift infrared saunas that aren't too expensive that you can set
Okay.
up at your home too.
That's a fun tip. And then
Yeah.
what am I missing? Is there something you want folks to know that I haven't dug into?
I would say, I talk a lot about becoming the boss of your biology. And I think, you talk a lot about this stuff too, just understanding that you have to do things, right? And so get into the habit of forming habits. And no matter what, like just starting small and having a good exercise routine, even if it's 5 minutes a day to start with, just do it every single day and have a 1% improvement every day. And then the other part of becoming the boss of your own biology is understanding like what are the markers of health, right? And so getting your blood test done, understanding what they mean, how you can change is so important, right?
Yeah.
And so just understanding your numbers. And we live in a really incredible time that everyone now for free can use artificial intelligence. And so
Yeah.
you can get your blood test results, upload them to ChatGPT or Claude or what have you, and say, how's my health? What do you suggest? What are some things I should ask my doctor about? What's the optimal diet plan for me? What is a good exercise routine for me trying to build muscle at my age? Those kind of things based on my blood test. Like you can do this very easily now, and it can really help start the conversation for you personally for your own personal biology.
And that's a good way to use technology for good, not evil, right?
Exactly.
So good. Okay, so we finish my show with a couple of things. Number one, a communication tip. So, what would you recommend for our folks to be able to connect with others better?
That's a great one. Learn something new, think about it, and start incorporating it into your life, and then tell other people how you did that and how it benefited you and how it can benefit them.
Uh,
I think teaching and improving other people's lives is a great conversation starter.
I love that. I
Yeah.
love that. And then, song of the show. So, we always encourage our listeners. I'm going to add it to the Fitzness playlist on Spotify. What song do you want people to add to their workout playlist, and what exercise do you want them to do while listening to your song?
Oh, wow. Let me think. What's a good song? Jeez, I can't. Can I pull up my playlist real
Yeah,
quick?
pull up your
Okay,
playlist. Why not?
let me tell you what I think is a really good workout song that I just added to my playlist. Here we go. Okay, I'll pick my favorite one here. Okay, Watermelon Sugar by Harry Styles. That's a good one.
That's a really good one.
Yeah.
That's a fun song. And what kind of exercise should they do while listening to that?
They should be doing rows.
Rows.
Yeah.
For their back.
For their back.
That's
Yeah, I
great.
think that's something that people miss a lot is their, like, I think you said it, like people work on their front
Yeah.
because they want to look good,
Yeah.
but your back is really like where a lot of longevity is, right?
Yeah,
Like,
it's a big
having a
deal.
strong back. Yeah.
That was great. Rose.
Yeah. It's
Rose.
watermelon sugar. I think that goes together.
I think it definitely goes together. Now, you're writing your first book right now.
Mhm.
Does it have a name?
Yes. N of one.
End of one?
N of one, like the letter N
Okay.
of one. So let me explain what that means.
Okay.
N of one means there's research studies that we do on thousands of people, but the best research study is the study that's done on one person, which is you. So the number N equals one of that study. And so we talk about in the book how you can run experiments on yourself and how to follow the data to really understand how any intervention, any exercise, diet, supplement is affecting you. And so this is how you can really personalize all the health advice out there to yourself to find out what works for you.
Well, hey, I can't wait to get that book. And I
Yeah.
hope everyone's going to put that on their list. One of the things I love is that's why I called my book You Supercharged, because it's got to be for the individual,
Yeah.
right? This is not about, keeping up with the culture. It's about making the best of you and your life, right?
Exactly.
Aw.
Exactly.
I'm so grateful that you all invited me here. Thank you so much
Thank
for having
you.
me.
Yes. I'm so excited you came. It was so awesome to meet you and so happy we're connected now.
Yeah, me too. How do folks find you?
My website, drshah.com. Next Health is our clinic. So we have clinics all over the country at www.next.health. And then we also have my podcast, Extend, where we dive like deeper into the science of all the things that we're talking about. And my Instagram is at Darshan Shah MD. And yeah, those are all my places.
Everybody needs to follow along and listen to the podcast. The podcast's really good, so I'm very proud to be a part of it. Your offices are incredible. Final task, you have to look into that camera and with gusto, tell everybody to get to work.
Get to work.
Bye, everybody. Love you.
Hi, this is Rudy Novotny, the voice of America's marathons. We all love how much running has benefited every aspect of our lives, so much so that most of us only wish we'd started sooner. Wouldn't it be wonderful to gift the opportunity to children of today? Well, you can. The Morning Mile is a before-school walking and running program that gives children the chance to start each day in an active way while enjoying fun, music, and friends. That's every child, every day. It's also supported by a wonderful system of rewards, which keeps students highly motivated and frequently congratulated. Created by our favorite fitness expert, Fitz Kohler, Morning Milers across the country have run over 2 million miles and are having greater success with academics, behavior, and sports because of it. The Morning Mile is free to the child, free to the school, and is inexpensively funded by businesses or generous individuals. Help more kids get moving in the morning by visiting morningmile.com. Champion the program at your favorite school or find out more about sponsorship opportunities. That's morningmile.com. Long may you run.